Gauteng EMS has appealed to residents to give accurate and detailed information when making an emergency call. Acting EMS CEO Ruben Reuters says this will assist in speeding up the response time of emergency services. The province has already had an increase in incidents compared to last year.
We've analyzed that in the main is that our citizens don't know where they are when they make emergencies. Maybe they are under distress, they are panicking, adrenaline is high, they are not observant as to their whereabouts, and to can give us the indication as to where are you, what is happening. So it's something that we continue to work in educating the community that when you call an ambulance, make sure that you give us clearly your name, your contact details, and be vigilant of where are you. Because we've seen that people will register, will say, we need an ambulance for a motor vehicle accident. And then our agents will then ask, where are you on the N1? And we realize that it's a problem. We end up having a delay right there of dispatching our resources to the right direction of the N1. And those are the things that we need to improve as a community to help us as well so that we can improve our response time.
Gauteng Health MEC Nomantu Nkomo-Ralehoko says critical lessons have been learned in handling large-scale emergencies. Today marks 2 years since the tragic Boksburg explosion on Christmas Eve. More than 40 people were killed when a dust tanker became stuck under a railway bridge and exploded. This festive season, the province has already recorded an increase in emergency incidents. Newzroom Afrika's Veronica Makhoali has more.
Well, the festive season is in full swing, but with it comes a number of numerous emergencies that the Gauteng EMS teams have to respond to. Today, the MEC of Health has been inspecting the Gauteng Emergency Command Centre to ensure that they are really up to standard in terms to responding to all those emergencies. I am joined by the MEC now. Thank you so much for your time. Just giving the briefing and what we've seen, there's already been an increase surpassing the number that we've seen of incidences and emergencies in December, looking from 44,000 in 2023, already at 48,000. MEC, what does this tell us in terms of the response team, but also what we're in for, given that it's already just mid-December?
We're worried that it's mid-December indeed and our numbers are going up. But again, since you have seen the improvement in terms of our command center, maybe those calls it's a sign that so many people now know where to go when they need assistance. So I think what we should do then is the educational awareness to our communities. We must make sure that people arrive alive, don't drink and get into the street, stay in your house. So we must avoid even some of the cases of assault that we have seen that the numbers are going up in terms of the cases of assault. So in fact, it's a number of issues that we must deal with ourselves after even this assessment that we are doing today at the command center. We need to strengthen again the capacity. We have seen already our staff is there still at work, but we must encourage them and make sure that they continue keeping up the pace that we've been doing, including the response of our time to the communities. That's very critical. But again, we need to make sure that then we work with the hospitals. There's that diversion policy that we're talking to yourselves about. That policy, we're going to strengthen it now because we need vehicles on site so that when we divert you from a specific clinic and we're taking you to a hospital or to a hospital to a clinic, there is an ambulance that is on site, that is waiting, so that we ease up the pressure that we're having, especially on the trauma unit side. All our wards are going to be packed. Accident and emergency areas are going to be packed. So we're looking into other alternatives so that people must not feel that they are being chased away in the hospital or they are not attended to. Everybody that gets into any facility must be attended to. And I think the whole team in the province, your chief directors, DDGs, HOD, MEC, all of us, we've assigned our task, we've distributed ourselves amongst the hospitals and among the clusters, including the CEOs of the clusters. Everybody that is not at work will come back to work. Those that are not there, there will be somebody that is acting so that when we call you, you immediately respond, because that's all that the citizens want. They need an agent response, and we have all the vehicles that you can see here. We have seen this last one that I've showed you, which is an emergency ICU ambulance itself. We have 21 ICU ambulances in the province where we can take you immediately and treat you in an ambulance, not wait until you go and then you die on site. The other issue that we're doing now, we're working with all the stakeholders. Forensic, you've seen they are here. We'll be with them on site until the 31st and the 1st of December, because we feel that when there's an emergency that must be attended to, a person has died, he has been gunshot, and that person died immediately on spot, we can't wait for hours for an ambulance and for a forensic team to come. Everybody will be working as a collective.
And I have to ask, MEC, as we reflect, it is Christmas Eve, and 2 years ago, we, of course, remember the tragedy that happened in Boksburg, where 41 people lost their lives after that tanker exploded. Lessons learned from the department in regards to responding to eventualities, especially during this time.
I remember some of us were out in the province. We had to flew back immediately on the 24th to make sure that we assist those families. We still pass our condolences to them, because that's not a good thing. Good thing is that at least we've been working with the families. We still keep that contact with them, including the NGOs that we've been working with them from the day that incident happened. They're still working with those families. So we really don't want that to happen. We are ready for any eventuality, any disaster that can come. Activated our command center, as you can see, in the whole province, including the GPG, by the way, because even this foodborne illness have helped us to activate the teams. I think we will be on track if anything that can happen.
Yeah. And I think a final question, we see the team is on the ground and they are on standby, but many do question the support given to some of the EMS teams during this time. And of course, the kind of situations that they see, specifically some of the attacks that we've seen on our ambulance vehicles, and I think as well just that mental health support.
We have mental support for them. We have a doctor that is on site. There's an ambulance, one of our CHISET, that is having in fact I call it a doctor's room. There is a doctor that supports them, counsels them, and even myself, I work very closely with them. But again, we have a group of chaplaincy that works with them. Even amongst the EMS teams, there are those that have been trained to be chaplaincy, including myself. By the way, I've been trained on that now, on chaplaincy, including the palliative care, because you just need sometimes a person to talk to. We have been training other members. I have trained myself on palliative care. As you can see, I've trained even on EMS. All these basic things that can make us closer to them. I always say to them, let's know that they are human beings too. They need to be loved. They need to be supported. They are traumatized, especially the Boksburg one, the Marshalltown incident that happened in Johannesburg. You remember all these incidents. We had to have sessions immediately after that and make sure that the teams get the necessary support that they need.
Well, thank you very much for your time, MEC. They're reflecting on the readiness of the EMS teams in terms of responding to incidents here in Gauteng, specifically over the festive season. Of course, speaking about the need for readiness, but also taking into consideration some of the flaws in terms of the EMS services, which was response time, adding, of course, that more resources have been added here at the command center to ensure that every call is answered and every response is heard. But also importantly is the security around ambulances. As we know, there are those criminal opportunities that happen over the festive season. For Newzroom Afrika on Channel 405, I'm Veronica Makhoali at the Gauteng Emergency Command Center in Midrand.